You've heard of many initiatives by the government and other organizations that tackle various health complications and issues affecting our society. Among those illnesses include chronic diseases such as diabetes and renal failure, as well as mental health conditions and the abuse of drugs, alcohol, marijuana, and tobacco. Well, today at the Ramada Belize City Princess, the most vulnerable population, the youth, was the target for an intervention. A youth health forum organized by the Ministry of Health in collaboration with various organizations sought to bring awareness of the conditions affecting the younger generation as a method of prevention.
We wanted to use an opportunity to empower youths as it pertains to health. Many times youths, they're not really thinking about health, and many people would wait until they're older or in middle adulthood to start worrying about health. As you know, we have a very young population, and our nation is pretty much unhealthy. We have a lot of chronic diseases. We have obesity, overweight. We have many risk factors. So we have to look at ways to try to empower young people and try to promote a healthy lifestyle.
Last week, the government of Belize officially launched a feeding program with a Mexican agency in 4 rural primary schools in the south. It is but one of the many tactics being used to promote healthy eating habits within the school setting. Nutritionist Robin Daly says that there is a move to further influence the types of foods being sold in schools across the country.
The Ministry of Education is working closely with the Ministry of Health to promote healthier foods available for youths, for students. There are school feeding programs that we work along with to ensure that they're providing a balanced meal. The snack shop and the cafeterias are a little bit more harder to approach in terms some of them are not managed by the Ministry of Education, so it becomes a private vendor kind of thing. But yet we're working on developing a school feeding policy, which will also impact what is being sold at the schools and what is available for students while they're at school.
A 2014 survey by the National Drug Abuse Control Council, the University of the West Indies, and the Organization of American States on high school students between the ages of 13 and 16 show that many have been exposed to drugs, be it alcohol, marijuana, tobacco, or even stimulants. Alcohol is the drug most abused, followed closely behind by weed, and then over-the-counter medication, stimulants, and tobacco. Even more staggering is the finding that the majority are polydrug users with 2 or more drugs.
Our responsibility is to provide not only the young people but also the general public with the information that is required. So in terms of alcohol, marijuana, tobacco, over-the-counter medication, stimulants, information that the people would require so that they would be able to make the right choices. Our work at the National Drug Abuse Council is not necessarily say no to drugs, but say no to drugs with the information that would empower you to be able to make the right choices in life. We have approximately 164 students, young people, that come through the doors of the National Drug Abuse Control Council seeking outreach services for any drugs that you can think about in the country of Belize. So it's a vulnerable population, and a vulnerable population that requires a lot of attention, that requires a lot of information, but also requires a lot of guidance so that they would be able to walk the right path.
The mental health of an individual is no longer taboo or for older persons. Even at a young age, a person can be suffering from a mental disorder, and it is expected that at this forum, the students will return to their classrooms, their homes and communities and share this knowledge.
As we look at mental health, there are many issues, and as a country, that's one area that I think poses a challenge as well to young people, because poor mental health might lead to substance abuse. It affects nutrition, and nutrition affects mental health, so everything is like linked in a way.
Duane, Moody for News 5.